First heart sound. First heart sound is S1, which is heard due to closure of mitral and tricuspid valve. It produces lub sound. Better heard at mitral and tricuspid area. Abnormalities of S1. First is loud S1. Loud S1 is seen in condition causing tachycardia, or short PR interval, means PR less than 120 milliseconds, which includes thyrotoxicosis, pheochromocytoma, CHF, severe anemia. Other causes include mitral stenosis, tricuspid stenosis. Physiological loud S1 heard in pregnancy, children. Soft S1 is heard in bradycardia, or long PR interval, means PR interval more than 200 milliseconds, which includes heart block, hypothyroidism. Other causes includes obesity, emphysema, pericardial effusion, mitral and tricuspid regurgitation, calcified severe mitral and tricuspid stenosis.